Hi guys, this is Jason Williams, DO. This is the Williams Family Medicine Channel, helping you to live your best life. Today I wanted to visit with you about weight loss medications. I see tons of patients in the office that are concerned about their weight, mostly concerned about wanting to lose weight. Weight and obesity is a significant risk factor for many health problems, and I'm not going to belabor all of the health problems that are related to obesity. Most people are aware of these. Instead, today's video focuses on some of the medication options that are available for weight loss and description briefly of how they work, and then also their possible reported effectiveness. To qualify for weight loss medications from the standpoint of insurance, they have some basic definitions. They use body mass index as a marker. Body mass index is not perfect and does have its pitfalls, but in general, it's a fairly good estimate for most people about where they are with their weight. If you have a body mass index of 27 or greater and have health complications secondary to your weight, then you would qualify for weight loss medication. Also, if you have body mass index greater than 30, you're considered obese. For both of these, patients are supposed to try lifestyle intervention first before starting medications. I think we all want to push the easy button and take a pill and get better and not have to put in effort to make changes. This is human nature, and there's nothing wrong with this. It just doesn't work that well. Even if you use a weight loss medication, you need to use lifestyle intervention as a pillar of trying to be healthy. A lot of weight loss medications are indicated for short-term use only anyway. So what are you going to do when you finish that medicine? What is going to happen to your weight if you have not instilled lifestyle intervention, good positive habits with diet and exercise changes? I stress lifestyle intervention as priority. I have other videos that address lifestyle interventions, healthy lifestyles that are likely to result in significant weight loss or prevent weight gain. Feel free to access some of these videos if you want more information on that. I wanted to go into some of the medications now. The first grouping of medications will be medications that have been approved by the FDA for weight loss. The first medication I wanted to talk about was Wegovy, W-E-G-O-V-Y. The other name for this is semaglutide. Semaglutide is a GLP-1 receptor agonist. Semaglutide is a medicine that was first brought out on the market for the purpose of treating type 2 diabetes. It was noted that patients did have significant weight loss with this medication, so it has also been used specifically for weight. GLP-1 receptor agonists like Wegovy suppress appetite and delay gastric emptying through hormonal effects. Side effects of this class of medicine include nausea, very common, stomach upset, constipation. More serious side effects might be pancreatitis, gallbladder disease, and aggravating thyroid cancer if you have a thyroid cancer. Studies have been collected, and in reviewing those studies, they report weight loss up to 14.8% of total body weight, which is pretty good. Next on the list is a cousin to the medicine we just discussed, also a GLP-1 receptor agonist. This one is called Saxenda, or liraglutide. The studies I pulled out showed about 5% weight loss. I should go ahead and say that these studies are pulled out of a collection of data from multiple studies and multiple sources. There's going to be some variance. I just want to have a rough estimate so I can give my patients a way to compare these medications. The next medication on my list is Qsymia, Q-S-Y-M-I-A. This is a combination of phentermine and topiramate. Phentermine is an amphetamine type product that suppresses appetite. Topiramate is an anti-seizure medication that has been out for many years, but has also been shown to decrease cravings. Potential side effects of Qsymia are constipation, dry mouth, dizziness, nausea. Unfortunately, increased risk of addiction with the amphetamine type product. Rarely, some people get numbness and tingling in the hands and the feet as well. Reported total body weight loss percentage is about 8.5% with this medication. The next medication I wanted to discuss is Contrave, C-O-N-T-R-A-V-E. This is a combination of Wellbutrin, bupropion, and naltrexone. Bupropion is an antidepressant that's been out for some time, and naltrexone is an opioid receptor blocker. The combination of these medications decreases cravings for food and also decreases the rush or the high that you might get from eating food. Common side effects include nausea, dizziness, headache, diarrhea, sometimes increased risk for seizures, dry mouth, elevated blood pressure, fast heart rate, and trouble sleeping. According to what I reviewed, I saw a weight loss percentage of about 30% of total body weight using this medication. The next medication I wanted to discuss is Xenical, Xenical, or also goes by the name Orlistat. This medication is a fat blocker. It prevents absorption of fat. So if you eat fat, it will go right through you. That leads to the side effects of nausea, abdominal pain, bloating, diarrhea, greasy, leaky stools. There's some reports that this may cause liver problems for some patients, although not substantiated. In my review, the total body percent weight loss that I noticed was about 5% after 1 year with this medication. I think this medication has a very high discontinuance rate due to the unsatisfactory side effects. Next, we have Adipex or phentermine. This one is probably going to be a medication that a lot of people recognize. It's an amphetamine stimulant, and it's one of the ingredients in the combination medicine that we discussed earlier in this list. Phentermine can be used by itself for weight loss. For short-term use is what the recommendations are if you read the package insert on this medication. It's an amphetamine stimulant and suppresses appetite. Side effects include heart racing, trouble sleeping, chest pain, increased risk for addiction, dry mouth. Total body percent weight loss with this medication, up to 7% after about 6 months. Next, I wanted to switch gears and talk about medications that are not FDA approved specifically for weight loss, but can be used for weight loss and have shown benefit. The first medication is Mounjaro, Mounjaro, or tirzepatide. This medication is a GLP-1 receptor agonist, similar to what we discussed earlier in Saxenda and Wegovy. Also is a GIP affecting medicine, GIP. It also affects GIP, which is glucagon insulin receptor. Mounjaro is a GLP-1 receptor agonist and also a insulinotropic-like peptide. This is a new class of medicine, and it was introduced for type 2. To date, one study is 22%, which is pretty impressive. This medication carries an answer, occasionally low blood pressure, increased risk of fractures, maybe secondary to low blood pressure, and falls. Appears pretty normal, but all doses. There is an increased risk with amputations when you. Some of the research I saw indicated about 3% body percent weight loss weeks. Next, I wanted to talk about Vyvanse, VYV. The other name for this is lisdexamfetamine. This medication is approved for ADD and binge eating, but not for weight loss. Amphetamine stimulant, so this carries the same side effects that we discussed with phentermine. The studies I saw indicated up to 12% total percent body weight loss with this medication. Fortamet or metformin. Metformin is a medication for type 2 diabetes and polycystic ovarian. Next, I wanted to talk about Fortamet, metformin. This medication is for treatment of type 2 diabetes, polycystic ovarian syndrome, and metabolic syndrome. This medication decreases intestinal absorption of glucose. It improves insulin sensitivity. This medication improves glucose uptake, decreases liver production of glucose, improves insulin resistance, improving glucose. It also decreases liver production of glucose. Pain, nausea, diarrhea, metallic taste in the mouth, rarely medication. This is a selective serotonin reuptake inhibitor used for depression and anxiety. This medication may work, which improves motivation, improves exercise. I could not see a definite mechanism by any of my research that was obvious otherwise to cause weight loss. And the studies are a little bit mixed. Some people gain weight while taking these medications. Any kind of effect